Good evening. England's junior doctors are beginning their longest strike yet today in protest over pay disputes with the government. The medical practitioners claim the government's refusal to negotiate ahead of the 5-day strike is not just baffling, but frustrating as well. Health Secretary Steve Barclay has labeled the doctors' demand for a 35% pay increase as unreasonable, expressing concern that the strike puts patient safety at risk. With the strike already in progress, thousands of planned medical appointments are being postponed as resources are reallocated to emergency and urgent care. NHS England advises anyone needing care during the strike to use 999 or on for life-threatening emergencies. For minor health concerns, people are urged to contact NHS 111 online or visit the nearest pharmacy. Stephen Powis, NHS England Medical Director, warns that the health service is entering an incredibly busy, disruptive period and that staff are doing all they can to maintain services, as they also tackle a record backlog of patients waiting for appointments or treatment. Indeed, over 600,000 NHS appointments have already been cancelled or postponed due to strikes by doctors, nurses, and other healthcare workers in recent months. Let's hear from Richard McKenzie, a marketing manager from Berkshire who has been directly affected by this strike. I was waiting for a knee operation scheduled for today, but it has been postponed because of the strike. The pain is like having a hot volcano in my knee and it feels like somebody sticks hot needles into it. This situation is completely affecting my life. Junior doctors argue that their pay raises for the last 15 years have been below inflation, necessitating a 35% pay increase now. They've labeled a government offer of a 5% pay rise as not credible. The British Medical Association, representing the doctors, has confirmed that 86% of its members backed the walkouts. These strikes are the fourth by junior doctors in England since the pay dispute began. Health and Social Care Secretary Steve Barclay responded that the pay demand of 35% risked fueling inflation. He urged the British Medical Association to show willingness to negotiate. While the junior doctor strike continues, more senior doctors, the consultants, will be going on strike themselves on the 20th and 21st of July. They will be providing what is being described as Christmas Day cover, with emergency care being provided along with a very limited amount of routine work. Beyond strikes, hospitals face other challenges to regain full capacity since the onset of COVID. These include staffing shortages, more emergency patients, and problems discharging patients because of the lack of care in the community. Currently, over 7.3 million people are on the waiting list, nearly 3 million more than before the pandemic. 1 in 20 has been waiting more than a year.